Today's topic is about healthcare crisis in the US. You may ask, what's the problem? The big problem can be summarized in two words: runaway inflation. Healthcare in the US can be characterized as high price, low quality, and not much choice. As a result, about 57 million people have been priced out of the healthcare system. They are the people who go without medical insurance. The citizens feel the pain of the high cost every day, and in recent years, US corporations too also feel the pain because corporations have to pay for the healthcare benefits of their employees. So this is the time for healthcare reform. Healthcare reform has been proposed by many US presidents before, but they have all failed. Right now, legislation is being drafted in the US Congress. And the time frame is there will be debates for a few months and then possible passage end of the year. This time, there's a better chance that healthcare reform will pass because everybody knows that the current system relying on private enterprise and profit motive cannot sustain. Healthcare in America has produced three problems, big problems. First one is a social problem, because if you have 57 million people uninsured, it's a social problem. It's an economic problem too, because the US corporations are paying more and more for healthcare. This increases their price of products. So if US products are subject to higher costs due to healthcare, then it will undermine the competitiveness of US products worldwide. Lastly, it's also a budget problem for the US government. It has been projected that the US government will go bankrupt due to the high expenditure on healthcare, because the US government is running two big healthcare programs. One of them is called Medicare, which is for seniors, and the other is called Medicaid, which is federal aids to local governments. Let me summarize the major issues. First of all, the US healthcare system is run by private companies with little government supervision. So you may ask, does the private enterprise motivated by profit works? Well, it has shown that it doesn't work very well in the healthcare system. The reason is that there is no free flow of information, because if you want a free market, you need to have free flow of information. The prices and the services of healthcare providers are not published. You don't know what kind of quality service they offer, and you don't know the price until you are sick. Then that's too late. Because of that, the public cannot compare and choose and find the best low price. It's not like buying a cell phone. If you buy a cell phone, you can go out, shop for it, and compare. If you are sick, you don't have the time to shop for the best low price. Besides, healthcare is subject to scare tactics, such as if you don't take this drug, or if you don't do this kind of procedure, if you don't do this kind of test, something real bad will happen. So a doctor can scare you. Another bad thing is that the insurance companies are getting into the way of healthcare because they have become the middleman between the doctor and the patient. So when you go to see a doctor, the first thing you do is that you fill out an insurance form, and the doctor has to tell you that, well, we submit the form and see if the insurance company pays for it. before he wants to treat you. And when the doctor claims for your service, he wants the highest price that the insurance company can pay. And when you want medical services, you want more than you pay for in the premiums. So in that case, what does the insurance companies do? Well, they have to make money, right? So what they do is that they enforce the price to maximize their profit. And as a result, both the doctor and the patient lose, because the doctor and the patient cannot determine the price. It's determined by the insurance company. Another factor is the trial lawyers. Trial lawyers can sue for medical mistakes made by doctors and hospitals. They can sue for millions and millions. But after they win the case, they take most of the compensation. Although they say that they are doing it for the patient, they take most of the profit. In this case, the doctors are made overly protective of themselves because you don't want to get into a lawsuit. In that case, what do you do? The doctors will tend to prescribe more tests than necessary for the patients. In other words, you go to see a doctor for some minor problem, you may wind up with a lot of tests that increases the cost of your medical expense. Drug companies too get a lot of preferential treatment from the government because they are very powerful and they have a lot of money to contribute to the politicians. And one of the examples that drug companies get from the government is prescription drugs for seniors. This program sounds very good, but in fact, the party that wins is the drug companies, not the public, not the seniors, not the government. We know that the legislators kowtow to drug companies, insurers, doctors, and hospitals because they are rich and powerful. In this case, it's very hard to get healthcare reform because the people who make laws can be a party to the people who make profits. So the conclusion is that healthcare reform will fail one more time, this time, if the runaway inflation cannot be contained.